PPE is the new normal in high-risk surgery, but what they've done at this cancer hospital is anything but routine.
We operate in a different way, but the results are good, as comparable and COVID safe.
Most hospitals have cancelled cancer surgery, but University College London has shielded one of its buildings from the virus. Only cancer patients who test negative for COVID-19 are admitted. Staff too are regularly screened and operating theatres are deep cleaned.
The risk is real during the peak. We did not know who was coming in with COVID. So despite having the PPE, with all the risks that we're minimising, this is working and functioning very well.
It's all good.
Results from the first 500 patients who've had surgery at the hospital during the peak of the pandemic show just 10 were diagnosed with the virus in the weeks that followed. None died. Studies from Wuhan early on in the epidemic showed that 1 in 5 patients having operations died soon after if they had the coronavirus. And that's largely because surgery in itself can affect the immune system. But here they have found a way of working that reduces the risk to zero. Many cancer services have been suspended during the pandemic because the risk of coming into hospital was thought to be too high for vulnerable patients. But there is now a backlog of thousands of operations, and delays in treatment can cost lives.
If you reduce the chances of COVID entering the hospital, you can continue with high-volume, urgent and cancer surgery with good outcomes for patients, which is particularly important because we know globally about 2 million operations are being cancelled a week. So there's a lot of need for this to be able to continue, and hopefully other sites can learn from what we've done.
Everybody's very happy to see that you're doing so well.
Yes, fingers crossed.
Tim Robinson had surgery 10 days ago. The safety measures at the hospital gave him peace of mind.
There was all sorts of fears. You just can't afford to delay. The hospitals are doing a fantastic job, and if you follow the COVID cleaning, don't touch your mouth, all the sort of things, you're going to be in safe hands.
Yep, that's it, exactly.
The coronavirus is likely to return in at least one more wave in the coming months. What medics have proved here is that vital surgery can continue, even in these difficult times. Thomas Moore, Sky News.